my name is Dr. Sri Marzouk. Thank you guys so much for having me today. So I'm a consultant pediatrician and working in pediatric allergy, asthma, and eczema. And I recently relocated from Toronto, Canada a couple of months ago, and I'm working with Dr. Umayma Malik at Circle Care Clinic. So I was, there she is right now. Okay, so the talk today is about food allergies. I have to say, since I've been in Dubai, I've definitely been seeing a variety of other different type of allergies. So this is pretty informal. If you have any questions at any point, please just raise your hand. You don't have to raise your hand, but just, this is a small group, just ask. And I'm sure your questions will be valuable to others here. So. All right, so some of the topics I was going to cover today is what is a food allergy, sort of defining it, because and my patients always know this, I love to use, diagrams, and I love to use pictures to explain things, and I really feel like education is power. So as a parent, when you really understand what's going on with your child, it empowers you to be able to use treatment if it's not needed, okay? So I'm gonna go through some of the common symptoms of food allergies, how we treat and manage food allergies. This is a really hot topic, I've noticed, in Canada and the States, but also since I've come here as well, food allergy versus food intolerance, trying to differentiate between the two. Allergies in adolescence, this is sort of, I guess, the point where parents are starting to let go a little bit. And then some new kids on the block. So what's new in the allergy world? Okay, so what is a food allergy? So the definition is an abnormal or really an exaggerated response of the immune system to a food or food substance. And I think that, most of, everyone's pretty familiar with the idea of that. But the idea of a food allergy is that you can have mild reactions, but sometimes it can lead to a life-threatening reaction. So I've put a diagram here of the more common allergies I've seen since coming to Dubai. I've seen a lot of peanut, lots of sesame. Shellfish is a common one, tree nuts, so that includes cashews, pistachios, walnuts, and pecans. And fish, soy as well, I've seen, egg, and various grains. So, this is a really simplified version of what, happens with a food allergy, but I show my medical students this a lot because I really find that, it sort of, it gives them an idea of what's going on and what's happening in the body. So I'm gonna use peanut butter as an example. So a child eats peanut butter. It goes down into the digestive system. Is there a pointer on this?
Yeah.
If there is it the red one?
Yeah.
Okay. So, perfect. So it goes down into the digestive system, and so you have your stomach here, and then it goes into the small intestine, which are these small squiggly lines right here. And this is where food is broken down and reabsorbed into the body. So when the food is broken down and reabsorbed, the immune system perceives it as something foreign. So it starts to produce antibodies, and the antibodies that it typically produces are called IgE. And the reason, we don't need to delve into this, but the reason that I say that, I want you just to remember that for later in the talk when we're going to talk about, different types of testing that you can do. And, IgE is simply just an allergy antibody that your body produces to specific foods. So you have peanut IgE, you can have cashew IgE, so it's very specific to food. And this is just a type of, various other types of antibodies that I have on the bottom here. And then what happens is those IgEs try and go find your allergy cells. So your allergy cells, they mostly live in your digestive system, in your respiratory system, so that's your nose, your lungs, and on your skin. So once the IgE, the peanut IgE, finds the allergy cell, it binds to it, and that allergy cell is almost like a balloon, and inside the balloon is where all the histamine is. So the histamine is what causes the reaction. So then when a lot of those IgEs bind to the allergy cell, it bursts. And that bursting is what causes the reaction. So that's when your child will get hives, sometimes facial swelling, so it depends where it's activating those allergy cells. And this is a really important concept, in terms of like treatment, but just to simplify it as well, this is why people take an antihistamine. So something like Zyrtec or, some Arius, Allegra, all of these are antihistamines. And so what it prevents the bursting of that allergy cell. Not sure if this is working anymore, the pointer. Okay, we're just going to continue on. All right, so what are some symptoms of food allergies? And I think it's really important to differentiate that a true food allergy, the symptoms, the onset is usually within seconds, minutes, and we generally say in the medical world up to an hour. You can have mild to severe symptoms, and I've kind of put some of the more common symptoms that I see in patients. So hives, I think, is probably the most common thing I see. This right here is a picture of swelling of the face, what we call angioedema. Sometimes you can have swelling of the lips as well, and then vomiting. So I have to say, in the younger children that I see, vomiting is definitely the most common. And again, the mild symptoms we treat with antihistamines, and the severe symptoms we treat with an EpiPen. So, and I'm just going to briefly touch on anaphylaxis, because I think this is a term that's sort of thrown around a lot. So anaphylaxis basically means that you have two of those symptoms that I described going on. So you can have hives and vomiting, you can have vomiting and facial swelling, you can have, low blood pressure, which usually in children is fainting. And so once you have two of those symptoms, that basically tells us that you have anaphylaxis. And epinephrine is the only treatment for anaphylaxis to date. So the EpiPen Junior for kids less than 25, and EpiPen, which is the adult dose, but for kids above 25. We always say activate EMS, which is the emergency medical services as well. And the reason that we say that is because sometimes when your body has an allergic reaction, it can actually have what we call a biphasic, so another reaction up to 6 to 8 hours later. So a lot of the times we suggest that you go to the emergency department and they observe you, up to 6 hours just to make sure you don't have that second reaction. So this is really important, how we diagnose a food allergy, because I think there are so many different types of tests out there, and I think as parents as well, I want you to really kind of have a good grasp of what we would use to diagnose a food allergy. So the history, which is the story, is 90%, okay? And I have a lot of parents, patients coming to my office, Dr. Shreen, can you test us for this, this, and this? Can you test us for this, this, and this? So the testing, yes, we can do. However, the testing is not 100%. So some of the tests are sensitive, and some of the tests are specific. However, nothing is 100%. And so this is why I always tell parents, the only thing that's ever going to be 100% in your diagnosis is what you're telling me, okay? And I want you to remember that, because your words, they mean a lot, and they are concrete. So, so the history is the most important part. And I have to say, after 15 to 20 minutes of sitting down and chit-chatting about what happened with a specific food, as an allergist, we have a pretty good idea of, is this a food allergy, is this not? And we're really just using the testing to confirm it, okay? So the testing is sometimes a guidance and a confirmatory thing rather than, something that's pretty set in stone. So the next thing that we do is the skin prick testing. So the skin prick test, it doesn't involve any needles. On younger kids, I do it on the back, on older kids, on the arm. So we clean the arm and we basically put serum, which is, it's basically saline mixed with, the allergen, whether it's peanut, cashew, etc. And then we scratch it, okay? And what that's doing is it's activating those allergy cells that you have in your skin. And it is, if you have allergy cells to that specific food, it should react, okay? And so after reading the test, we have a pretty good idea of, is this a true allergy, is it not? And sometimes we do specific IgE blood tests. So that doesn't mean like a blood test panel, but it means very specific to the food. And then lastly, food oral challenges. That's basically, just when we give the child a very small amount of the food and see what happens. Food oral challenges are really done when we're not 100% sure what the diagnosis is. So a lot of times I have, parents coming in, they've eaten this food 5 times and they've reacted, once, or they've been eating this food their whole life. You can develop allergies later, but then, the history is sort of, it kind of doesn't fit our, that box, and so you have to kind of dig a little bit further. So how do we manage food allergies? Well, 3 simple steps. So food avoidance, and this is changing a little bit, and I'm going to talk about it a little bit later. So I think it's really important to say that we shouldn't be eliminating foods from our children's diet unless we've had a good discussion with our healthcare provider. And that's mainly because a lot of the foods are giving our child various minerals, vitamins, etc., that they need for growth. And eliminating that is, sometimes it can affect the child. Local reactions, so that's again, one of the things that I had talked about. So, sometimes kids will develop a puffy face, sometimes they'll develop hives. And so antihistamines, so we use the newer antihistamines, Zyrtec, Blexten, and there is another one that we use in North America called Rupall, which I have seen it available here in some of the pharmacies, not all the pharmacies. But one of the more important things is I wanted to say do not use Benadryl or Fenestil because I've seen those used here. And there was a position statement by the American Academy a couple of years ago actually saying you should never be using Benadryl. And just because it's a cheap medication, it's used a lot in the emergency department, and it's probably the oldest antihistamine that's been around. And the reason is because it has sedating side effects on children. And so a lot of times, when kids come in to emerge, we have to try to figure out, okay, are they, woozy, and are they a little bit sleepy because their blood pressure is low because they're having allergic reaction, or is it because of the medication? So, so this is a really important point. And then systemic reactions, as I said, EpiPen Junior or the EpiPen, and I'm sure all the allergy parents are familiar, blue to the sky, orange to the thigh. Okay, yeah, for sure.
So I was always told to use Benadryl, in case of mild reaction. So Zyrtec is as good then as in terms of suppressing?
So Zyrtec is even better with the onset and timing. Okay, so Benadryl was the advice that we gave probably 10 to 15 years ago. Okay, since then there's been newer drugs that are A, more effective, and B, less side effects. Okay, so Zyrtec, absolutely. Yeah, absolutely. It's quicker onset, and it's a lot more effective. Okay.
What about Aries? A lot of pediatricians here recommend Aries.
So Aries is good as well. Aries, it does fit in with the newer generation. And Zyrtec, I probably would be my first choice here. Aries is one that we, sometimes use a little bit more for seasonal and environmental allergies. It's not wrong to use it, but Zyrtec for food allergies has a little bit of a quicker onset. So who's at risk? So there's something that we call the atopic triad, and that's basically if your child has eczema, if they have asthma, or they have environmental allergies, they're more likely to have one or the other. And that's just because of genetics. And of course, family history as well. So family history of food allergies, and it doesn't necessarily mean if you have a shellfish allergy that your child is at more risk of having a shellfish allergy. They're more at risk of having a allergy, but not necessarily to the exact same food, but they have a predisposition to develop allergies. And for those kids, it's really important to discuss with parents early food introduction. So now, we're kind of shifting in pediatrics, 4 to 6 months, you introduce everything, eggs, peanut butter, dairy, and this is very different from what we used to recommend, you know, even a decade ago. Okay, so food intolerance, I have a couple of slides on this just because I find that, you know, a lot of the times, you know, parents may come in and you know, they're unsure whether or not, is this an allergy or is this an intolerance? So a food allergy primarily affects your immune system. A food intolerance is a digestive system issue, okay? So it's the inability of the digestive system to properly break down the food, and that could be for various reasons, depending on, you know, what's going on. Again, the clinical history, so the story is the most important thing. You know, and I always tell patients keeping a food diary is really important because, you know, we all get busy in our day-to-day life, and having that food diary, and yeah, you know, every morning, you know, when they have cereal, or every morning when they have that glass of milk, you know, they're complaining about belly pain, they don't want to go to school, you know, and so having that food diary is really important. So specific testing, it's not very accurate in children, okay? And we don't do it a lot, and sometimes, you know, when you go into a doctor's office, you just want to do tests to confirm what you think is going on, but that's not always the answer, okay? So sometimes eliminating the food and actually following up after a couple of weeks is sort of the best course of action. So that's kind of the course of action that I take, because even for lactose intolerance, I can't, you know, think of how many hydrogen breath tests, you know, I do for children that are completely negative, but they have the symptoms every single day after they're eating dairy. You know, they have gas and they have bloating, they have belly pain, and it's causing them issues. And so for me, that's basically enough, okay? And so this is just kind of a diagram that I came across a couple of months ago that I found was really nice, because, you know, it kind of delineates the difference between both immune system and digestive system, as I had said before. But what I always say to my medical students, a food allergy, serious symptoms within seconds. You know, I always say SS, serious symptoms within seconds, you know, or minutes. Food intolerance is discomfort for days, okay, DD, so discomfort for days. And so one is, you know, sort of very long-term. Another one needs treatment immediately and sometimes doesn't go away on its own and will come up every single time that you have the food. So the other thing I wanted to talk about was the IgG food panel testing. So this has been very, very common in Canada and the States, and it's almost become like such a lucrative business. And, you know, unfortunately, I've seen this being done here as well, which is, I don't know if you guys have heard of the IgG food panel testing, but I think here they just call it food panel testing. So food panel testing is not recommended, okay? And the reason it's not recommended is because if we go back to our, okay, well, maybe I won't go back to the very first slide, but the very first slide that had that IgE, okay, that antibody, that specific allergy antibody, this doesn't even test for that. So that is the only type of antibody your body produces when you have an allergy, okay? So this actually tests for something called IgG. And you'll get a report back and it will say, oh, your IgG is, you know, you'll have eggs and toast for breakfast, and oh, your eggs IgG is really high. Your toast IgG is really high. And based on that, you know, someone may tell you that you have an insensitivity or an intolerance and you should eliminate it. Absolutely not, okay? Because you should have an IgG to eggs if you just ate it this morning. And again, you know, the saying is we are what we eat. Our immune system is what we eat as well. Anything going into your body, your immune system produces memory cells, okay? And IgG is really just a memory cell. So I had peanut butter this morning, great, I have IgG to peanut, you know? And so it really doesn't tell me anything about intolerance, it doesn't tell me anything about, you know, food allergy, and I think that's something really important just to put in the back of your pocket if you're ever recommended to do this test. The other thing too is that it is quite expensive, and you know, we've seen that you know, in Canada it's not covered, by the health insurance there, but it's also not covered in, every other country. And here, I think it's upwards of like 3,000 or 4,000 dirhams, something like that. And then, more importantly, it leads to unnecessary food elimination, okay? So this is a whole topic on its own, but I'm gonna put this in here because I've actually seen a lot of, students from high schools in Dubai that are starting to think about, going away for university, traveling on their own. And I think allergies in adolescence is a really important topic, and sometimes one that may be overlooked. And we know that this is true for a lot of things, but the teen years, the responsibility basically shifts to the child, okay? And sometimes it's hard for, I guess, us as parents to sort of let go, but, empowering your child is, I think, the most important step that, you could take as a parent. So, and teens do best when they understand their management plan well and are well supported. So I always go through this with my teens, and I always tell them there's 6 important areas to master, okay? And really at the end of the day, it's really all just about confidence building, okay? And we know the more confidence you instill in them, the better they do and the more prepared they feel, okay? So mastering your allergy action plan. So if you have allergies or if you have asthma, you should have an action plan. An action plan means what to do and when to do it, okay? So recognizing what their allergy symptoms are, and every child is very different. So I have some children that when they have an allergic reaction to a food, they may break out in hives. Other children may start to feel like some mouth itching and then have one of their, part of their face swell. So every child is very different, and you have to understand what your child's symptoms are. And what we do is we basically use action plans. So there is, a Canadian one, there's an American one. I actually really like the British one. And I'll show you why I like the British one. It's a little bit more detailed as to what to do. So this is the one from the American Academy. And the one from the American Academy basically says, this is what I'm allergic to, and this is what I do. I give an EpiPen. Okay, well, we all know that. But the British one that was actually just released a couple of years ago, it has a really nice diagram of what you should do and what position you should put them in, okay? Because we want them to be in a lying down position, not sitting up, standing up. They can be sitting up as well in a chair, but optimally to be lying down. And then more importantly, they have kind of the definition of a mild to moderate reaction here in blue. And so not every time you have an allergic reaction, you need to take your EpiPen. But if it's severe enough, yes. If you have 2 things going on, yes, you need to take your EpiPen. But if it's just one thing, like these mild reactions listed, this is the antihistamine to take, and you can put it in here. So I like it because it has what to do with mild reaction, what to do with a severe reaction, which is, give your EpiPen, but the positioning as well. And it kind of has step-by-step how to give your EpiPen. So there's different ones. In North America, we have Emerade. We have a whole bunch of different types of EpiPens. I think EpiPen is the most common one used here, so this is why I use this. So this is one that I give to my patients here and actually in Canada as well. So label reading. When a child starts to spend time on their own, it's time to start reading their own labels, okay? And you can teach them, so some kids I allow may contain, some I don't. It really depends on the severity of the allergy. And read the ingredients every time because ingredients can change. And the general rule of thumb, I tell them if you can't read the label, don't eat it, okay? And practice makes perfect. So, the first time it may be, a little bit awkward for them. Second time, they're gonna ask. Third time, they're probably gonna go grab the box before, anyone saying anything about the food, just because they're, again, preparing ahead and they know. So managing food allergies at home, it all starts at home, okay? And I tell parents, keep them involved in meal planning, grocery shopping, and cooking. Just even preparing very simple meals. I think that's an important step because especially if they're going to be going away for university, doing their own grocery shopping, Sometimes, universities have obviously meal plans, but knowing, what kind of, snacks or simple meals they can sort of put together quickly that are healthy and appropriate as well for their allergies is important. And then deciding on a location for the antihistamine and EpiPen at home. This is also an important one because sometimes, you sort of get comfortable with the idea and then, if something happens, you can't remember where it is. So just kind of keep it. And I will say the EpiPen at room temperature might be a little bit more difficult to do the room temperature here if, they're spending a lot of time outdoors. So maybe, if there's a nearby fridge or something that they can keep it in. So managing allergies at school. So this is an important one. I always tell patients they should have 2 EpiPens at school. So one on them and then one in the medical office, okay, or the nurse's office. Food sharing. So this is an important one in general. Children should not be food sharing. I know we've been a little bit more diligent since COVID, sort of, telling patients about this. So talking to them about school events where food is present. So this is, again, they sort of ask on their own and, get into the habit of read labels if you are training them to do so. Washing their hands before they eat because, again, they may shake someone's hand or they may, hold something that has a little bit of peanut remnant on it or cashew or shellfish or whatever it may be. And then they start eating their own homemade sandwiches at home and then have a little bit of mouth tingless. And it just doesn't make sense. Well, washing your hands is really important for a number of reasons, but also for allergies. And then obviously letting school staff know about their allergies. So navigating social settings. So this one again is really just about being prepared. They're eventually going to be eating out at restaurants, eating out at, friends' houses. If they are doing so, try to get them to even just think about looking at the menu on the website before, and then communicating with restaurant staff. So, I have a lot of patients that may go out to eat with their parents, and the parent will say, okay, my child has a peanut allergy or my child has a shellfish allergy, so we just want to make sure that none of this food contains, and so I say to parents, let them, you call over the waiter and then let them tell them about their allergy because, again, practice makes perfect. And then always ensure your EpiPen is on hand. So other social settings, so always try to bring safe foods, okay? Especially if they're going, camping in the desert or something and there's a pre-planned meal for them. Always try to prepare a little bit. Openly communicating with friends. This is a really important step because we know peers are probably the most important thing in the adolescent years. Close contact, such as mouth kissing, that can be that can transfer allergens, so that's important to to let them know about. And then alcohol actually contains many hidden allergens, and it does increase the severity of reactions, because it increases the rate of metabolism and the rate of breakdown of the food, okay? Travel, so again, sort of the same concepts. Have your EpiPen, have your antihistamine. You may need a letter from your doctor. Informing the staff members that are traveling with your child. Maybe even sometimes, I give my parents here just a demo EpiPen, and I tell them, teach whoever is, going to be traveling with your child how to use it and just kind of getting a hang of it. So printing a digital version of your action plan, having it with you, and having one, with the personnel that's traveling with you, safe snacks, and then this one is important, knowing where a nearest emergency department or hospital is. And this is generally planned out, by the person who is, arranging the trip, just in case of anything, if there's any injuries, et cetera, et cetera. Okay, so supporting self-esteem and confidence. I think this is a really important topic. I mean, I could talk about this for days, but I sort of touched on how peer support is really important. Encourage them to tell their friends about it, and encourage them to come to you, if they're feeling sad and frustrated. And when friends understand, I always tell parents they're more likely to include your teen and more likely to, do appropriate activities. Anxiety is another huge topic in allergies. And again, I have to say as a precursor, the more they know and is gonna, the more confident they are gonna feel, okay? And sometimes it will help a little bit of the anxiety, but some common misunderstandings too that I see that, provoke that anxiety is, just being near food is really dangerous. Or, if you're touching the food and then eating, with it, yes, that can be dangerous. But if you're just, around it, or you're breathing it in, or you're on the airplane, you have to be breathing in a lot of the particle in order for it to be absorbed into your respiratory system to produce those IgE to activate your allergy cells, okay? And it's all about the amount, actually. So if you're, if you're in a room and it's filled with peanut dust and you're allergic to peanut, yes, you are likely to have an allergic reaction. But if someone's eating a peanut butter sandwich, a couple of meters away, you're likely to be okay. And then have a discussion with your healthcare provider, and sometimes we do need to refer to a psychologist that is skilled in dealing with adolescents with anxiety. So just very quickly, a couple of new kids on the block. So oral immunotherapy, this is what I've been doing for the last 5 years, and it's basically microdosing of food allergens to build the immune system tolerance, okay? So it's not a treatment for your allergies. Your allergies will not completely go away. So it's not like if you have a bacterial infection, I'm giving you an antibiotic to get rid of your infection. But again, the oral immunotherapy is again to decrease the number of IgE you develop every single time you eat the food, okay? And the whole idea is everyone has a certain threshold. So, some people may be able to tolerate a little bit of peanut, some may be able to tolerate a moderate amount until they have a reaction. And so it's almost pushing that tolerance a little bit higher. So it's most effective in preschool age, and it can be done up to 16 years of age. There are people in Canada and the States that are doing it in the adult population. And then anti-IgE medications like Xolair can be used in conjunction with OIT. So this was really exciting news for us last month. The FDA basically is looking at approving Xolair for food allergies. And again, what Xolair does, so it's an anti-IgE, so it decreases the IgE that's produced to specific foods that you're allergic to. It's already on the market. It's been used for years and years. We use it for children that have severe asthma or children that have what we call idiopathic urticaria, which is unknown hives, and it works quite well for them. So the other one, Neffy, so this is undergoing a clinical trial, but it's the epinephrine nasal spray, okay? So instead of injection, you spray it in the nose. Has not been approved by the FDA. The FDA actually just came back last month and said you need to do a little bit more of further studies to compare, the efficacy of inhaled epinephrine versus given by needle. So, I mean, Neffy is a new kid on the block, but we're just going to keep an eye on him. And that's pretty much it. So just some closing remarks. Again, education is key. The more you understand, the more you can empower your child. Being prepared builds confidence, and help your child master their allergy action plan, and involve them in early food prepping, because again, that gives them more confidence. And if you're unsure whether your child has an allergy, please seek help from a professional. And these are a couple of resources I love to give my patients. So the American Academy has a lot of really nice handouts for teens. It also has like a library of resources. So if you get diagnosed with an allergic condition, you can just go to their website and put it in. Has a lot of reliable information. The Food Allergy Resources is another great website. That one is used for new diagnosis and resources for parents. And then I personally love Food Allergy Canada. And just because there's a lot on Food Allergy Canada, just because I deal with a lot of young children as well, how to introduce these allergens when they're young, when to introduce it, and what way to introduce it. And then they also have a really nice handout for teenagers with anxiety, and it's called Living Confident with Food Allergies. And this is it. This is my hometown in Canada, St. John's, Newfoundland. And this was a picture taken over the summer. So that's it.